Hello everyone, this is Dr. Alal again. Today I'll talk about COVID-19 pandemic infection again. This is called a novel coronavirus, meaning it is new virus discovered in the world and we don't know the complete picture of this virus. Every day we are getting new information. Every day we are getting new presentation of this disease. So I'll catch up on something I got here and more clarification on misconceptions. So this is the third critical condition the world is going through after World War First and Second. So we can say this is World War III against COVID-19 infection. So I came to know the most common misconceptions on the transmission. Again, I'll talk about the transmission. As I said, three common mode of transmission. Number one is contact transmission, from eye to face. Second, large droplet transmission. Third, airborne transmission. If I draw a picture of transmission, you see this in this picture. This infected person or asymptomatic carrier, when sneeze, talk, or cough, can produce large droplet. This is number one transmission mode of transmission. Large droplet size is more than 20 micrometer. This large droplet can fall onto the surface. And another person, this person is not infected yet, but touch the surfaces and touch their T area, mean eyes, nose, and mouth, can get the infection. Second way, when this person sneeze, cough, or talk, and this large droplet can fall onto directly on this person T area if this person stays in 6 feet. Third, the critical mode of transmission is airborne transmission. Same thing, this person can produce some micro droplet that cannot see on naked eyes. Size is less than 10 micrometer. This micro droplet can float or suspend into the air for a couple of hours and can travel further distance, beyond 6 feet. And if another person come in contact with this micro droplet that is already suspending or floating on the air, can get infection. So this concept is very important. What kind of PPE is important for you? So most scientific evidence and strong evidence suggests that mass number of population, vast number of population getting infected by first two mode of transmission, large droplet, directly infect the person who is in 6 feet and from eye to contact, from eye to face contact. So number one and number two transmission we can prevent by taking two actions. One, regular hand washing with soap water, and second thing is alcoholic sanitizer, and alcohol must be more than 65% concentration. So most effective way to break this cycle is hand wash, and do not touch your T areas, eyes, nose, and mouth, if you touch any surfaces. So wash your hand with soap water, mostly soap and water. That's the most effective way. If you do not have soap and water accessibility, you can use alcohol-based hand sanitizer. Second, you can wear a surgical mask, because this droplet is large size, more than 20 micrometer. So surgical mask is enough to prevent this large droplet. Third critical mode of transmission is droplet transmission, and to prevent this transmission you have to wear N95 mask. You have no other choices. So now I would like to talk about the level of population, who needs what type of protection. So for non-healthcare worker in general public, they will need two different kinds of precaution. One is distance, social distancing. If you stay more than 6 feet away, you're less likely to get this infection. Second, frequent hand washing, and do not touch your tea areas after touching any surfaces. Third, this mode of transmission is very critical. So for healthcare workers, frontline healthcare workers, doctors, nurse, technicians who involved in healthcare industry, like uh, cleaner, like who is dealing foods, nutritionist, dietitian, transporter, there needs this kind of airborne precaution. So for airborne precaution, you must need N95 mask and your eye protection, eye shield. If I talk about the types of masks you need to use for public area, those who are not in healthcare field, is enough to use your surgical mask. This is called level 1 mask. Or if you don't have access to the surgical mask, you can wear cloth mask. That's enough. And most critical point is social distancing. Do not make any crowd. Stay home, and you can save yourself as well as your family, your country. Come to my dear friends, my dear colleagues, seniors, my teachers who are working in healthcare field. You must need N95 mask and your face shield. These two things is mandatory. In this critical condition, in this stage, treat every patient considering their COVID-19 positive, their coronavirus positive. So again, consider every patient think that they're positive until and unless you are classified by your PCR test or whatever test is available at your hospital. So for healthcare workers, you must need N95 mask and face shield. But if you work in a critical care department, ICU department, and if you work as an anesthesiologist, surgeon, you must need another, the surgical hood is called respirator hood, and the hazmat suit. So for normal healthcare worker who is attending inpatient, who is working outpatient department, you must need two things, eye shield and N95 mask. If you work in ICU, if you are an anesthesiologist, if you are a surgeon, you must need additional thing, the complete respirator hood, or it is called powered automated respirator hood with the ventilation. That's very rare, so I would say you need N95 mask, eye shield, the respirator hood, and hazmat suit. Please don't take it easily. The airborne transmission is very critical. You have to take care of yourself. So now the point is, I came to know some doctors are attending patient in outpatient department wearing the hazmat suit. You don't need hazmat suit. It's not mandatory. The infection is getting only through your mucosal surface and the breath. Means your T area, eyes, nose, and mouth. You have to only take care about this T area. It doesn't matter the virus is falling on your chest, your hand. Do not touch the T areas. That's enough. You don't need hazmat suit. Hazmat suit is only required for anesthesiologist who is intubating, ICU care doctors, and surgeons. So again, most important thing is prevent your T areas. That's enough for you, but N95 mask is mandatory. So wear your N95 mask and wear another surgical mask on top of N95 mask to protect your N95 mask. That's the way you can use your N95 mask at least 4 to 5 days. And of course, you gotta wear your eye shield. you can wipe down the eye shield with germicidal wipes like Clorox, and you can wear your surgical cap like this. You can wear this surgical cap. That's enough for your head protection, and you can wear gloves. If you don't have hazmat suit, nothing to worry about, because the infection is only transmitted through your mucosal surface and through the breath. So another important information is aerosol producing procedures. Let's say a laparoscopic surgery. For laparoscopic surgery, you need to infuse carbon dioxide in positive pressure way. So every kind of positive pressure can cause a huge amount of aerosol. Thus, aerosol is airborne transmission. So until and unless it's life-threatening or you need it, I think at this moment you have to postpone your all routine laparoscopic surgery. Those who is involved in intubation, basically critical care doctors, anesthesiologists, if you code a patient and patient needs CPR, I think do not detach the patient from the ventilator circuit, because if patient is in ventilator circuit, the patient is no longer risk for this virus transmission because it's closed circuit. But if you disconnect the circuit, it's a huge chance to produce aerosol. So if you code a patient, you can still connect the patient in the ventilator circuit, keep the PEEP 0, lower down the tidal volume, and decrease the rate, and still you can continue CPR. Those who are intubating patient, it's mandatory wear your respirator hood addition to your N95 mask and eye shield. That's very important. So I would request my colleagues, friends, you're very efficient, especially those who completed a post-graduation training like FCPS, MD. You're very efficient. You guys are very intelligent. You're very efficient healthcare worker. So I would say this is our decision. We took our decision to be a doctor to save this humanity. So as a Hippocrates oath, we have to take care the humanity sacrificing our life. So we cannot leave the battlefield. We know we have the shortage on PPE, but still try your best, stay strong, stay safe. Thank you. I would like to draw a kind attention of our Honorable Prime Minister Sheikh Hasina. You took the right decision to lock down the country and launch the special forces to maintain the lockdown. It's really appreciating. That was really needed at that time, and that's the only way we can save our beloved motherland. We can save our 170 million people. And I'd like to request you, আপনি যদি একজন এমপিকে বাঁচাতে লক্ষ কোটি টাকা খরচ করে ডক্টর দেবী শেঠি কার্ডিওলজিস্টকে বাংলাদেশে আনতে পারেন, আমার মনে হয় 170 মিলিয়ন পপুলেশনকে সেভ করতে আপনি নিকটবর্তী দেশ চায়না থেকে, যে দেশ 3 ঘন্টা ফ্লাইট ডিস্টেন্স, সেখান থেকে আপনি লাইফ সেভিং পিপি, বেসিকলি N95 mask, goggles, and some hood respirator. That's really important for healthcare workers. So I would like to request you, I'd like to draw your kind attention. It's possible for you if you think on it, if you work on it. So every life is important for themselves. So please take an appropriate action and employ some educated, experienced people in your structure. Thank you very much.